Systemic lupus erythematosus second type is the drug-induced lupus. These cases of lupus are caused by certain medications. People with drug-induced lupus may have many of the same symptoms of systemic lupus erythematosus, but it's usually temporary. Often this type of lupus goes away when you stop the medication that's causing it. Next type is a neonatal lupus, a rare type of lupus. Neonatal lupus is a condition found in infants at birth. Children born with neonatal lupus have antibodies that were passed to them from their mother, who either had lupus at the time of pregnancy or may have the condition later in life. Not every baby born to a mother with lupus will have the disease. Causes. The cause of SLE is not clearly known. It may be linked to the following factors: genetic factors, environmental factors such as UV radiation or sunlight, hormonal like sex hormone, estrogen. Women are most affected than men in reproductive years and less affected in non-reproductive years. Certain medicines like procainamide, hydralazine, and isoniazid can cause lupus. Symptoms can vary and can change over time. Common symptoms include severe fatigue, joint pain, joint swelling, headaches, a rash on the cheeks and nose, which is called a butterfly rash, hair loss, anemia, blood clotting problems, fingers turning white or blue, and tingling when cold, which is known as Raynaud's phenomenon. This can periodically get worse, known as flare up, and then improve. Pain areas in the muscles. Pain types can be sharp in the chest. Pain circumstances can occur while breathing. Whole body symptoms like anemia, fatigue, fever, or malaise. Hair loss or loss of scalp hair. Skin, red rashes. Skin can have red rashes or scaly rash. In mouth, symptoms like dryness or ulcers can be seen. Also common anxiety, blood in urine, clinical depression, face rash, flare, headache, joint stiffness, Raynaud's syndrome, sensitivity to light, swelling, water retention, or weight loss. Diagnosis is difficult because of variety of people and variety of symptoms. How is SLE diagnosed? Doctor will do a physical examination to check for typical signs and symptoms of lupus, including sun sensitivity rashes such as a malar or butterfly rash, discoid rash, photosensitivity, mucous membrane, ulcers which may occur in the mouth or nose, arthritis which is swelling or tenderness of the small joints of the hands, feet, knees and wrist, hair loss, hair thinning, signs of cardiac or lung involvement such as murmurs, rubs or irregular heartbeats. Investigations include blood tests such as antibody test and a complete blood count, a urinalysis and a chest X-ray. Anti-nuclear antibody test. This test looks for antibodies, proteins in body that defend against disease. That could be a sign of an autoimmune disease. People who have SLE usually test positive for ANAS. This test is not very specific. Other autoantibody which is specific for SLE is anti-Smith targets ribonucleoproteins, anti-double-stranded DNA target seen during active disease. Treatment for SLE. There is no cure for SLE exists. The goal of treatment is to ease symptoms. Treatment can vary depending on how severe your symptoms are and which parts of your body SLE affects. The treatments may include anti-inflammatory medications for joint pain and stiffness, steroid creams for rashes, corticosteroids to minimize the immune response, and anti-malarial drugs for skin and joint problems, disease modifying drugs or targeted immune system agents for more severe cases.